Hi, I am Dr. Ashish Talukdar. Recently, I passed the USMLE Step 1 exam, and now I am preparing for USMLE Step 2. And currently, I realize that there are some special topics. They are very much important and equally important for USMLE Step 1 and Step 2 CK. And actually, these type of questions are very much tricky. If you know the tricks, you can easily choose the correct answer within a few minutes and can save your times in exam. Okay. So today I chose an excellent questions for the students who are preparing for USMLE Step 1. So let's start. So look at the screen. A 32-year-old African American man with iron deficiency anemia comes to the office for a follow-up examinations. He has adhered to his medications of ferrous sulfate, which he began 6 months ago. He has not had bloody vomiting or blood in stool or urine. He has smoked one half pack of cigarettes daily for 10 years. He drinks 6 to 12 beers on the weekends. Vital signs are normal. Conjunctival pallor interest is not found, and the others exemption is normal. Okay, and the left findings is showing 6 months ago today hemoglobin is 10.7 and today 10.9. So it is not jumped so much. Hematocrit 32 and today 33. Erythrocyte count normal. MCV 72 and today 72. Leukocyte count is normal. Platelet count is normal, and red cell distribution wide is normal. Okay, and iron profile studies showing 6 months ago iron is 60, today 75, transportation saturation is normal. So what will be the answer? There is five options. So you can pause the video here and think. Okay, let's jump to the answer. Okay, option A, celiac disease. Okay, you know the celiac disease is a GI disorder. Mostly it affects the duodenum, so it can cause microcytic anemia, most probably diagnosed anemia. And the celiac disease patients have some other problems, like the patient complains of diarrhea and has some skin problems in the elbow. But these patients continuously taken paracetamol for 6 months. If the patient has celiac disease, this patient's condition should be improved and has some other symptoms, as I said earlier, diarrhea and skin problems. Okay, but this patient has no problems like this, has no symptoms like this, so we can say that this patient has no celiac disease. Okay, second option is myelodysplastic syndrome. You know that myelodysplastic syndrome is a rare disease, and it is very rare before the age of 50 years, and these patients only 32 years old. Okay, only 32 years old, so it is a very rare condition. And you know that in myelodysplastic syndrome, it actually affects the bone marrow of all cell lineages. Okay, RBC, WBC, and the platelet count. So all these three cell lineages should be decreased. But from the lab studies, we see that only the hemoglobin level is decreased. The platelet count and is normal, so we can easily cancel the myelodysplastic syndrome. Okay, and also in myelodysplastic syndrome there are some risk factors, like if the patient previously received any radiotherapy or chemotherapy, this patient has a high risk of getting myelodysplastic syndrome. Okay, and now move to the third option, occult GI bleeding. So occult GI bleeding can cause I don't even say anemia. Okay, but the patient's already taken ferrous sulfate for 6 months. His condition is not improved, so it cannot be occult GI bleeding. Fourth option, pure red blood cell aplasia. Pure red blood cell aplasia is a required condition, and you know that in that case, uh, it almost completely destruct the red blood cell lineage. So we should expect that this patient's hemoglobin level is much lower. Okay, like 7 to 8 gram per dl. But in that case, this patient has hemoglobin level 10.7 or 10.9 today. So this is mild anemia, so it cannot be pure red blood cell aplasia. So the last option is thalassemia. So correct answer is thalassemia. Why thalassemia? So main why I chose the questions, because in every exam, is only step 1, step 2, and all type of medical exam, it is a uh, burning questions. Thalassemia, how to differentiate thalassemia and iron deficiency anemia. It is so much difficult in exam in a very short time, so there is a tricks. So First of all, what is the tricks? You should look at red cell distribution wide in exam. Just look at the red cell distribution wide. In thalassemia, it should be decreased to normal. Why? Because in thalassemia patient is constantly producing abnormal RBC. Okay, abnormal RBC. So the red cell size constantly low, or sometimes it's normal. So as red cell distribution what is normal. But in case of iron deficiency anemia, patient is producing small size of RBC, and sometimes normal, sometimes is bigger. So red cell distribution wide in iron deficiency anemia, it should be increased. In almost all of the times, the red cell distribution wide RDW should be increased in iron deficiency anemia. But in that case, we look that the RDW is normal, so we can differentiate from that, from seeing that the option in a few seconds, so we can choose the correct answer. And another tricks, that in transfusion saturation, in case of iron deficiency anemia, transfusion saturation should be what? Because we know that transfer saturation is equal to serum iron divided by total iron binding capacity. Serum iron should be decreased in iron deficiency anemia, and TIBC should be increased. So the ratio for the transfer saturation should be decreased. But in that case, it is normal. Yeah, it is normal. Okay, and there are a lot of hints that this patient is thalassemia, because these patients came from the African American descent. Okay, and this patient's condition is not improved after taking ferrous sulfate for 6 months. So the home taking message of that question is that you should look at the RDW to differentiate from thalassemia to iron deficiency anemia. Okay. Okay, this is my new channel, USMLE Helpline, and this is my first video. I hope that I will make some more videos regarding how I pass this step on exam, and my preparation techniques, and how is the exam exam conditions, and etc. Okay, so please subscribe my channel and hit the like buttons, and I will appreciate your time.